Welcome back. Let's go back live to Hartford HealthCare Studios where Sarah Lewis joins us. Oh no, she's at her house, in fact. She's the Vice President of Health Equity for Hartford HealthCare. Sarah, thanks for joining us.
Thanks for having me.
Tell us about Hartford HealthCare's existing Foodshare partnership and how the need has emerged since this COVID pandemic.
Yes, so this started as a pilot program just a few months ago. The innovative thinking of my colleagues at Hartford HealthCare at Home and the Center for Healthy Aging, witnessing when some of our patients were being discharged from rehab or acute care settings that they were food insecure, empty refrigerators, bare cupboards. And so they came up with an idea to create emergency food boxes full of shelf-stable food. We partnered with Foodshare because they can get that food at cost or lower. And some of our Hartford HealthCare employees helped pack those boxes. And now we're seeing that beyond the Healthcare at Home and Center for Healthy Aging needs, greater needs from our patients who are coming from the emergency departments across our acute care settings and from people who are being treated by Hartford HealthCare for cancer right now. So we're happy to be able to provide them with that emergency food box for those who need it.
What a great program. All right, tell us about the data we're seeing here in Connecticut and elsewhere about the greater prevalence of COVID-positive cases and mortality rates among Black and Hispanic populations.
Yeah, this data is really disturbing, and we're really at just the beginning of it because we're at the beginning of the pandemic. Unfortunately, the rates that we're seeing across the country, such as in Michigan, where 40% of the deaths from COVID are among the Black population, but they only account for 13% of the population in the state overall. This is actually for people who focus on health disparities and work on health equity. Like I do, this is unfortunately not surprising. There were a number of longstanding disparities that existed before the emergence of the novel coronavirus, and unfortunately that virus is sort of opportunistically taking advantage of those and exacerbating them. You would not have been outlandish to say that the health status and health outcomes among Black Americans and many Hispanic Americans as well was in a crisis setting prior to the pandemic, and now I think we're seeing that a new emerging crisis can make existing crises worse. So, for instance, in Connecticut, we know that where you live, your zip code can determine how long you live. In the Hartford area, for instance, there's a 15-year difference in life expectancy between the north end of Hartford and West Hartford Center, just 4 miles apart. In the Fairfield region, we see a difference of about 19 years between Bridgeport and Westport. And these numbers are astonishing. This is pre-COVID. You know, that's a whole generation, if you think about it, the amount of time you could spend with 19 years in your life if you had it. So we as a system, that's why we have a health equity department, because we know the importance of reducing health disparities among our most vulnerable populations.
Wow, you talk about it, but those numbers really share the cold, hard facts. All right, how is Hartford HealthCare, and just real quick last question, responding and moving forward?
So we are really grateful that the state of Connecticut has started to release data on race and ethnicity here in the state, and we are seeing an elevated, as you mentioned, rate of positive cases among the Black population and death rate as well. We encourage the state to keep doing that. We internally are looking at data as well, and we look forward to partnering with the public health establishment, other providers across the state to figure out how we can prevent and protect when it comes to COVID-19 so that the crisis doesn't further exacerbate the existence of these disparities.
All right, Sarah Lewis, thank you for being with us today. We appreciate your time.
Thank you.
Thank you.